All right, let's start with case 1. Who wants to go tell me what this one is? Or do I just tell you guys what it is?
Well, I guess with this one, I favored kind of a mid to deep dermis inflammatory process.
Yeah.
Kind of as you zoomed in, you could see some eosinophils, some fibrin around the blood vessels and leukocytoclastic. So overall for this one, I favored one of the medium to large vessel vasculitis. And with the eosinophils, I kind of lean more towards Churg-Strauss.
Yeah, so these are, I think these are still relatively small vessels. They look bigger, they're kind of expanded, but most of the vessels are in the dermis, and I think of most of the dermal vessels as being kind of on the smaller side, although I guess it depends, what scale you're using. But like you said, the thing from low power is this is superficial and deep, right? The vessels in the superficial, mid, and deep dermis are all involved, and it seems to be going down even to the subcutis. And when you look at the infiltrate, there's numerous eosinophils, right? Eosinophils everywhere. And even right here, like, see this vessel? It's not, you don't see obvious vasculitis here, at least I don't, but it does not look like a happy vessel. It's swollen. It's like the endothelial cells are bulging into the lumen so much that you can't even see the lumen. So that to me is an evidence usually that there's some sort of vascular irritation or damage. And I'm going to look more carefully to see if I can find vasculitis in that context. And then over here, I think we are starting to see it. You can really see blood leaking through the vessel wall, some fibrin right here, fibrinoid necrosis. Not a ton of neutrophils here, at least not that I can see, although on when there's a lot of eos, sometimes neutrophils and eos kind of mimic each other a little bit. You can, up close on a light microscope, you can see, because you can see the granules on the eos, and the granules on neutrophils are really, really tiny. You can't see them unless you have like oil immersion. And this is a really damaged, torn up vessel here with endothelial swelling and fibrinoid necrosis of the vessel wall. So it's basically a variation of leukocytoclastic vasculitis in which there are a lot of eosinophils and it's superficial and deep. So like you said, right away you want to think of Churg-Strauss disease, which is also known as eosinophilic granulomatosis with polyangiitis or EGPA. I've seen some cases that just look like regular LCV, but with EOs, this one's like really florid in EOs. Sometimes the EOs can kind of cause degeneration of the collagen, and you can get things that look almost like palisading of granulomas, like kind of like histiocytes or eosinophils clumping around collagen bundles. So some cases of Churg-Strauss will show that. But I think anytime I see a leukocytoclastic vasculitis with a lot of EOs, I want to keep Churg-Strauss in mind. And then they can clinically check if the patient, do they have asthma? Because these patients essentially always, I think, have asthma and other lung issues. And then they can do additional workup like testing for ANCAs. And that also, I think, is a key kind of a general take-home about vasculitis, is that when you have cutaneous LCV, the kind of simple form of LCV, leukocytoclastic vasculitis limited to the skin, usually it involves the vessels up here in the superficial vascular plexus, and you don't usually get deeper involvement. When I see really robust vasculitis, particularly that's going way down deep in the dermis, that is right away suggestive that this is some form of systemic vasculitis. It's not a hard and fast rule, but I actually often even put in my pathology report, there's a lot of deep vessel involvement, which is particularly concerning for one of the systemic forms of vasculitis. And also, if you see vasculitis that's so robust that it's causing either necrosis of the epidermis, pustule formation, or blister formation, that again suggests such a severe and usually goes hand in hand with deeper vessel involvement that it's so bad that it's cutting off blood flow to the skin and causing some ischemic change, which is degenerating the epidermis. Again, that often is a sign that it's a systemic vasculitis. So, Churg-Strauss syndrome, good.